There are two words that no athlete ever wants to hear. Can you guess what they are? Stress fractures. That slowly growing sharp pain in your foot or leg or foot or shin can become more than just a nuisance over time if it is not properly treated. I have endured my fair share of stress fractures throughout the many years I've spent training and competing in track and field. My freshman year of high school, I ran on bilateral tibial stress fractures for about 3 months. Bilateral tibial stress fractures simply just means I had stress fractures in both tibias. And just this past year, I fractured my fifth metatarsal in my left foot during my first indoor college meet. Not how I was hoping that race would go at all. Brian Fullman, who is a podiatrist, wrote an article in Runner's World that states a stress fracture is a crack that does not go completely through the bone. Initially called march fractures, they were first noted in 19th century Prussian soldiers who marched too far or too often. Knowing the symptoms and warning signs of a possible stress fracture can help you become more prepared in dealing with it. Stress fractures plague the running community often due to the strenuous nature of running. However, stress fractures can occur in anyone and everyone, so if you understand what a stress fracture is and can recognize the symptoms, the sooner you can get an accurate diagnosis and increase the speed and quality of your treatment. The first step to understanding your stress fracture is learning why this has occurred in the first place. So what is a stress fracture? A stress fracture is a partial crack in the bone, most often in lower extremities such as the tibia, fibula, and metatarsals. When looking out for stress fractures, it's important to know your signs and symptoms. Major symptoms include shin splints. So if you're not sure what shin splints are, imagine this is your bone and this is the muscle behind it. So this is your calf and this is your tibia. Say you're beginning your first season of cross country and you weren't really a runner before, so you're putting your body through a whole new stressor. So when you begin running daily, when you weren't previously a runner, your calf muscle will become very, very tight. Once this tightness gets to a certain point, it will begin to actually pull away from your bone, leaving the bone on its own to take all the stress of running. So if you begin exercising a lot, the muscle may pull away from your bone, and then your bone is taking all the force you're putting on it, and it may begin to crack. In addition, increased muscle tightness and sharp pain in your bone are also telltale signs and symptoms of stress fractures. If you were to put external pressure on your bone, say push on your shin with your finger, and the pain worsens, that's also a pretty good sign that you are developing a stress fracture. Also, stress fractures do not improve with continued use. I learned this the hard way. After many years, I finally will listen to my body and know that if it hurts, it's best to take a break, get some ice on it, get it stretched out later, and then go back to running. The second step in treating your stress fracture is recognizing the cause. Most often, increasing the duration of your training, increasing the intensity too quickly, changing your training surface, improper equipment such as improper shoes to a new runner, or low bone density are all often causes of stress fractures. Adam Yankee, who's a sports medicine orthopedic surgeon, reminds us in his article in Sports Health that even non-athletes are susceptible to developing stress fractures in their daily activities due to low bone density. Osteopenia or osteoporosis are two of those low bone density conditions. However, the most common cause of stress fractures is overuse. And like I said before, track and field is a very common sport where stress fractures occur due to the nature of running. According to an article published in 2003 on the American Family Physicians website, track and field sports account for 64% of stress fractures in women and 50% of stress fractures in men. Crazy, right? The next step towards getting back on the track or on the field is taking a trip to your local sports medicine or orthopedic doctor to get checked out. First of all, before you even get there, you do want to stop running or exercising. You'll only make the stress fracture worse. Next, go see that doctor. And then the doctor will likely order an x-ray to check out your shins. The x-ray most often does not completely confirm a stress fracture diagnosis because it is not a complete crack in your bone. It won't show up, so a bone scan is often needed for confirmation. In addition, CTs and MRIs are also often used to confirm a diagnosis, or in my case, I had an MRI done after my treatment to confirm that I was completely healed. Once you have a diagnosis in hand, your next step is to treat those bones. Rest, rest, rest. This is the best medicine for a stress fracture. And if you can't sit still, if you're like me, you're often able to cross-train. Swimming or biking are great alternatives to running. Dietary supplements are also often recommended to patients by their doctors. They're often recommended calcium along with vitamin D supplements, the calcium to repair, and vitamin D to help absorb the calcium. Immobilization is also a common treatment, at least in the very beginning stages. As you can see here, there's immobilizer boot. I was actually in one very similar to this the past Christmas break when I fractured my foot. I was in it for about 5 weeks. Crutches also may be used for their first week or two of treatment. Once you're all healed up and you have the go-ahead from your doctor, come back slowly. Overdoing it will just land you right back where you were before. You should never have to go through the pain and struggle of stress fracture, and if you can prevent this, this will make you much happier. So like I said, prevention is number one for your future. It's the key to success. If you do happen to go through a stress fracture, you will need to strengthen those muscles afterwards. And please continue to meet dietary needs, meaning increase your calcium intake and vitamin D for your body. Now that you know the signs and symptoms to look out for when increasing the intensity of your workouts and training, you can hopefully prevent injuries such as stress fractures from occurring. Exercise should be enjoyable while challenging, but never painful.